Hi, how's it going? Hope you all are keeping safe out there. You are welcome to our YouTube channel, Farmer Beta, simply looking after you. So, the reason why we came on today is to discuss the seven core signs of medical malpractice. Oh, yeah, seven core signs that are suggestive of medical malpractice is necessary. You have those at the tip of your fingers so that you can identify trigger signs whenever you visit any health facility in Nigeria and use your red card properly, because that's the only way you can stay safe, avoid being a victim of medical malpractice. Yep. Okay. I hope you still remember our website address so that you can pop in and read up. Farmabita, www.farmabita.com. Okay, the seven core signs of medical malpractice. The first one is non-existence of doctor-patient relationship. Second, unexplained disease progression. Third, patient little or no knowledge about their diagnosis. This can invariably affect compliance and adherence. The fourth one is discrepancy between symptoms and diagnosis. This one is a bit tricky, but we'll get to it in our subsequent videos. The fifth one is outcome of laboratory investigations not being disclosed or discussed with the service users who happen to be the patients. The sixth one is unnecessary tension among the healthcare professionals in a health facility, which sometimes can involve the non-medical staff. The seventh one and the topic for today is unlabeled dispensed drugs. I'll say that again. Unlabeled dispensed drugs. Some of you who are fortunate to live in the big cities in Nigeria by now will be like, oops, in this 21st century, is it obtainable that someone could actually accept a drug without a name, talk more of taking it home to ingest it? Oh, yes, it is very possible and obtainable. In fact, for the couple of months that Pharmabita has been on, majority of the messages we get from our inbox are regards to, could you help us? Could you help me identify the name of this medicine? And when I try to find out where they got such medicines from, majority of them were actually from the hospitals, the private hospitals mostly. No offense, please. But that is not suggestive that the government owned ones are not included. You just need to be on the watch out. It is a breach of your right. It is medical malpractice giving you a drug with a no name. Now you know whenever you visit any hospital and a drug is being dispensed to you, ask for the name if there is no name on it. In fact, ask for all the necessary information. You should have them at your disposal. It is your right. Okay, I'll just give me a couple of seconds and I will show you what an ideal properly labeled drugs should look like. Okay, I've got this one. See the name of the pharmacy. The encryption is up there because they take pride in what they do, and I'll just cover my address. I crossed out my baby's name, his date of birth. You could see the name of the drug, the dosage, the storage, the name of the prescriber, that's the doctor, and all the vital information you need. And I know by now some of you will be wondering what drug is this. This is simply amoxicillin suspension, 250 milligram. You can get it in open drug markets in Nigeria. Really pathetic. But this is how a properly labeled drug should look like. And I've got another one here. Yeah, I should have gotten one of those funny looking dispensing envelope they usually put the counting drug in. Um, those envelopes are not ideal to package drugs. I know the constraint, but they can get punctured by sharp objects and degrade the pharmacological action of the drugs in which they are packed in, and most times the seals are not very airtight, and it does not really cost so much to get this plastic to ensure that the drugs are airtight and well preserved for the service user. Okay, this is amlodipine. You could see the name of the pharmacy, you could see the name of the doctor, you could see the name of the patient, and you could see a warning sign up there: avoid grapefruit and eat juice while on this drug. This is how a counting dispensed drug should be packaged. Ideally, this is how it should be. And this is another one. You could see the name of the doctor. This is calcium. You could see the dose of the drug. You could see every information you need. So from now onwards, do not take any drug without a name on it. Not just because if you eventually have adverse drug reactions so that you could assess the right antidote, but because it is a breach of your rights and it is a medical malpractice. And if we don't speak up and come together to make sure that the people involved realize that it's not good, it will escalate. You know how it is in our part of the world. It will become a norm that you shouldn't know the name of the drug you take home. So by doing this, what do we aim to achieve? That you are safe, that the service provider start doing the right thing, because when the service provider got to know your rights, they have to correct the wrongs they are doing. And by that way, our medical system will be getting to a standard eventually. I know we'll get there someday. Don't forget to use your red card, and when you're sure, get a farmer beta. Stay safe while using any health facility in Nigeria. Still your girl, Juliet Chinelo for Farmer Beta. Bye for now.